Good evening, Bermuda. I begin my remarks tonight by sending my sincere condolences to the family and friends of former Senator and Junior Minister Laverne Ferbert, who sadly passed away this weekend. She was fearless in her convictions and unwavering in her support of Bermuda's workers, social justice, and equality in our society. Ms. Ferbert will be fondly remembered for her strength, dedication, and vibrant spirit. Following consultation with the Leader of the Opposition, the government will designate her funeral a recognition funeral, which means that an official condolence book will be prepared and assistance will be lent to the family for funeral arrangements by the government's protocol office and also support from the Department of Communications. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update on the vaccination program, including the number of residents vaccinated, the number of persons who are registered, and the forward plans regarding vaccines and other matters related to our ministry that are important that persons pay attention to. I will be providing an update on the changes to the current measures, which measures will remain in place, and I will also touch briefly on the expansion of the vaccination program and answering some questions which have come in online from a number of persons regarding rule changes in the future and what can we plan and expect. First, we'll hear from the Minister of Health. Minister of Health.
Good afternoon, everyone. Today, there were 306 test results received by the Ministry of Health since our last update, and none were positive for COVID-19. Additionally, since the last update, one case has recovered. There are currently 11 active cases, of which 7 are under public health monitoring and 4 are in hospital and none are in critical care. Since March 2020, Bermuda has recorded 692 total confirmed cases of COVID-19, and out of these, 669 persons have recovered and 12 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 43 years, with the median 40 years, and the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 55, with the median age being 50 years, and the age range from less than 30 years, and that age group is 20 to 29 years, to greater than 80 years, and that age group is from 80 to 100 years. To protect privacy and confidentiality, age information will not be provided on the hospitalized cases. The mean age of all deceased cases is 75 years, with the median being 77 years, and the age range from less than 60 years, age group 50 to 59, to greater than 80 years, and that age group is 80 to 100 years. The source of all cases is as follows. 200 are imported, 489 are classified as local transmission, of which 399 are local transmission with a known contact or source, and 90 are local transmission with an unknown contact or source, and 3 are under investigation. As investigations proceed, transmission categories may change. Today's update has 2 cases moving from under investigation to local transmission with an unknown contact or source. Of the more than 160,000 test results reported, the mean age of all persons tested is 43 years, with the median being 42 years, and the age ranges from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is less than 1, namely 0.39, and Bermuda's current country status is sporadic cases. I would like to now provide you with an update on the COVID-19 vaccination program. We have completed the 3rd full week of vaccinations and the first full week of vaccinations using 2 vaccination centers. For the period through the 30th of January 2021, Bermuda has vaccinated a total of 4,897 persons, representing an additional 1,965 persons. And the breakdown is as follows. A total of 2,223, or 43%, are males, and 2,774, or 57%, are females, with 1,039, or 21%, persons under the age of 50, 1,108, or 23% of those persons are between the ages of 50 and 64, 1,741, or 35%, are persons between the ages of 65 and 90 79, and 1,009, or 21%, of those persons are over the age of 80. However, by including yesterday's numbers, we have well exceeded 5,000 vaccinations, including more than 200 persons who are now fully immunized. We would note that the data is generally provided by an epi week, and any data provided within 1 to 2 days of the vaccination is considered preliminary. Of the vaccine sites, and based on the epi week ending the 30th of January, the vaccination center at the Police Recreation Club administered 3,084, or 63% of the vaccinations. 182, or 4%, were administered at rest homes. 1,573, or 32%, were administered by the Bermuda Hospitals Board, and 58, or 1%, were administered at corrections. Assessed against our vaccination targets, the ministry can report that of the first groups in Phase 1A, we have vaccinated 1,009 persons, or 32% of those aged 80 years or older. 326 persons, or 44% of those in rest homes and long-term care facilities. 676, or 28% of healthcare workers, and 960, or 41%, of essential service workers. Whilst we are pleased with the numbers of persons vaccinated thus far, we must ensure that all persons in the critical groups that are at risk are safely vaccinated. If you know anyone in any of our high-risk target groups who has not registered their interest in getting vaccinated, please encourage or help them to register online at forms.gov.bm/COVID vaccine. The second batch of 19,500 doses of the Pfizer-BioNTech vaccine arrived last Friday after being delayed by 1 day due to the inclement weather that we experienced. The arrival of these additional doses means that we can now start moving towards Phase 2 of the National Allocation Strategy. While we continue to ask those in priority groups 1A and 1B to register their interest and be vaccinated, we are also asking those residents in Phase 2 to register their interest online. Phase 2 is people 50 years and older, as well as vulnerable persons, such as those that have heart disease, chronic kidney or liver disease, and diabetes, for example. Essential travelers and residents with disabilities. I must repeat, registering your interest does not guarantee you an appointment at this time. When you submit your registration form, you will receive an auto-generated submission receipt. Your submission will be filed and you will be contacted as appointments are scheduled. Please remember that appointments are based on a medical risk assessment that in turn is based on age and clinical vulnerability, and this is carried out manually by our medical team. Every submission will be replied to and there is no need for you to resubmit. With regard to the numbers of persons who have registered their interest, to the week ending January 30th, 227 persons have registered their interest in getting vaccinated. And the breakdown is as follows. 2,261 are black, 6,717 are white, 1,187 are mixed or other, and 3,062 not specified or prefer not to say. It is important to note that our data confirms that trends of black registrations are climbing. The initial need to prioritize the first shipment of doses is under constant review, especially as we have now received an additional vaccine shipment. Our overarching goal is to assess to the vaccines by every resident, and we will constantly be adjusting to ensure and enhance access to vaccinations for all. For those of you who have registered already, I wish to thank you. I want to ask those people who are waiting for their appointments to please be patient as the ministry continues to clinically assess each registration. While you wait, though, please read the COVID-19 vaccine information and consent form online at gov.bm/vaccines. This document contains important information about the vaccines, and it will make the process at the vaccination center quicker if you read it before you get there. As we continue to receive more doses of the vaccine and transition through the phases, there may be changes to the existing protocols, and these changes will be widely communicated to the public as they become effective. One such change that is we now require residents to bring a Bermuda driver's license or proof of residence when you come to your vaccination appointment. A second change is that all those arriving by car to the police club must check in first at the Clyde Best Center. Please do not drive straight up to the police club. What has not changed is that vaccinations at both vaccination centers are administered by appointment only. The Ministry of Health continues its work reviewing and assessing potentially suitable locations to serve as additional vaccine centers. This is necessary because as of yesterday, February 1st, we are now administering both first doses and second doses. And this means that we must increase our capacity in order to reach our goal of vaccinating approximately 1/3 of our population by the 31st of March. I would ask all residents who are scheduled to receive their second dose, please do not miss your appointment. This is critically important for two reasons. First, as the vaccine has strict quality and storage standards, the ministry prepares the doses daily based on the scheduled appointments of that day. As such, we must closely monitor the doses and make sure that all doses prepared are actually administered. Our mandate is to ensure that we do not waste a single dose, so please attend your appointment as scheduled. And second, the two-dose regimen, as recommended by Pfizer, is proven to be dramatically more effective. While you get some immunity at approximately 52% from the first injection, the second dose boosts your immunity to 95% effectiveness. If you do have to change your appointment, we ask that you call the vaccination hotline at 444-2498, selecting option number 2, or email vaccine@gov.bm as soon as you can so that we can reschedule your appointment. Wearing masks, physically distancing, good hand hygiene, and downloading the We Health Bermuda app will help reduce your chance of being exposed to the virus or spreading it to others, but these measures are not enough. The vaccine will work with your immune system so it will be ready to fight the virus if you become exposed. If you do get COVID-19, you are likely to experience milder symptoms and become less ill as your body is better able to fight off the virus. We understand that some people may be hesitant, but we are confident that as you do your own research through trusted sources, you will be able to make an informed decision. As the Premier has said before, the government is committed to ensuring that all residents have access to accurate and up-to-date information. Please visit www.gov.bm/vaccine to learn how the vaccine works, find out about its safety, review the benefits, and more. We owe it to ourselves and our loved ones to use every tool at our disposal to try and slow the spread of coronavirus, and the vaccine is without a doubt the most valuable and effective tool that we have. Also, the ministry acknowledges that there are several persons in our target phase groups of phase 1A and 1B who have mistakenly provided to us the wrong phone number when they were registering, thus preventing the hotline team from contacting them to make an appointment. If you are in one of those first two groups, particularly if you are more than 80 years old, please contact the vaccine hotline at 444-2489, again using option 2, to make sure that you get vaccinated. With respect to the COVID-19 testing generally, residents needing outbound tests must book themselves in our outbound travel testing via one of our community sites, namely Pennell's Wharf, Bull's Head, or Star of India. Do not go to the PROT post office for this. You can book through gov.bm/coronavirus get tested. There will be no walk-ins. We recommend that you book 2 days before the date you plan to leave Bermuda. This meets the 72-hour rule for the United States and the United Kingdom, and when flights resume in Canada, and it gives MDL Lab more leeway to process results in time for your departure. As the half-term school break approaches, the Ministry of Health advises against non-essential travel off the island for all Bermuda residents during the COVID-19 pandemic. However, if travel is absolutely necessary, the Ministry of Health has developed guidance for the safe return to school and daycare after travel. These guidance requirements are the minimum recommended for schools and daycares and shall be used to implement policies for teachers, staff, children, and parents in school and daycare settings. You can find this guidance at gov.bm/coronavirus schools. In closing, I also have to update regarding saliva testing. Now, the World Health Organization currently does not recommend the use of saliva as the sole specimen type for routine clinical diagnostics. However, saliva may be used in specific cases where collecting nasopharyngeal swabs can be problematic, such as in mass screenings, or especially when elderly persons with dementia or young people may be involved. And as such, Bermuda has implemented saliva screening program in which any person testing as a presumed positive of saliva must have a nasopharyngeal sample tested for diagnostic confirmation. Saliva screening of select populations began on the 28th of September 2020, and these populations included the long-term care facility staff and residents, BHB staff and patients, select essential service workers, other vulnerable populations, and other select groups such as hospitality workers. And as of the 30th of January 2021, results have been received for 4,467 saliva screenings, of which 2, which represents 0.04%, have been presumed positive. These numbers have not been previously reported for the aforementioned reasons that I spoke about, and they are screening rather than confirmation tests. We intend to find a way to report these stats so that we give recognition for the screening work that is being performed locally and to maintain public confidence as we remain vigilant for outbreaks in general. Of the 2 presumed positives, 1 was confirmed as positive by the nasopharyngeal swab, and the mean age of all persons screened is 59 years of age, and the median is 59, and the age ranges from less than 10 years to greater than 100 years. Finally, until we reach herd immunity, we encourage you to get tested and to know your status, register to get vaccinated, and never forget to avoid the 3 C's: closed spaces, crowded places, and close contact settings. Thank you.
Thank you, Minister, for that very comprehensive report and update. And it's amazing to know that with the vaccinations that took place yesterday, and certainly the work that's taking place today, that we have now administered doses to well over 5,000 people in Bermuda, or administered well over 5,000 doses. And certainly there would be 5,000 persons who would have gotten a first jab of the vaccine. So I am very grateful for the work that is certainly taking place. On behalf of Bermuda, the people of Bermuda, I want to thank you and your team for all of the continued hard work, energy, and effort that has been going on for so long. The health workers of this country are our heroes, and whether it's outbreaks, whether it's calm times, whatever time it is, they have been working at this day and night for the last 12 months, and we owe them our gratitude. Earlier today, the Cabinet met to discuss the measures in place during the public health emergency related to the coronavirus. In line with recommendations from the Ministry of Health and with the support of the Covid-19 Cabinet Committee, which did meet yesterday, earlier today, the Cabinet agreed to the following changes. First change is that indoor funeral attendance can increase from 20% to 25% of the maximum capacity of the facility in which it is held. Outdoor funeral attendance can increase from 25 persons to 50 persons. Table size within restaurants, bars, and nightclubs can increase from a maximum of 6 persons to a maximum of 10 persons. The government is also changing its advice regarding working from home. Before, working from home was strongly recommended. We are now changing that, and we encourage remote working where possible. Measures that are not changing. The current curfew will remain in place from 12 midnight until 5 a.m. This decision was taken with advice from health that curfew has been effective in reducing social mixing. I know that many want to end curfew, and I would like to be able to do so as well. But at this time, the health advice is that it continue to remain in place, and we know that it is important that health advice is adhered to. Group gatherings in a private or public setting outside of an outdoor funeral will remain at a maximum of 25 people. This has not been increased and again will remain at 25 persons. The changes will come into effect on Thursday, February 4th at 6 a.m. As per normal, these measures will be reviewed by the Cabinet on a regular basis, and the next update is expected in 2 weeks. The government understands that many may have been hoping, and my social media is without question telling me that all measures, including the curfew, would have been relaxed completely, and therefore may be disappointed that, for now, it remains in place. It is essential that we are cautious and calculated as to when we relax each measure. It is important to remember that COVID-19 is still a threat, as we see it to continuing to disrupt life around the world. For persons who are saying that the curfew should end because our active cases are so low, before our last outbreak, our active cases were low too. And it is essential that we continue to confirm that there is not a risk, as it will only take one super spreader event, just as we had before, to put us back into the same situation where we were. So we are going to continue to work through this process, and do not let the numbers fool you, as you may be lulled into a false sense of security. And we've learned from our lessons, and we are not going to repeat those mistakes. Please adhere to the measures in place, get tested, and if eligible, register for the vaccine, and ensure to get both shots to be fully protected. Remember, testing is free for residents. If you are going to host an event at your place, which is not advised, you should consider asking your friends to get tested. The last thing that you want is to be stuck in quarantine, or worse, contract the virus and pass it on to your family. There is testing capacity here in Bermuda, which has not been reduced, as some has suggested, and it is important that we take advantage of that testing capacity. Yesterday, the Minister of Health, the opposition leader, government science advisor, Dr. Krika Weldon, and I were fortunate to receive our second vaccination shots. I am doing fine and just well. I thank the nurses and staff at the Police Recreation Club Vaccination Center for making it an efficient process and ensuring that everyone who attends is seen to professionally. I also want to thank the Royal Bermuda Regiment for their support of the Vaccination Center's operations and their ongoing service throughout the pandemic. As the minister mentioned, Bermuda has now received its second delivery of vaccines, with an additional 19,500 doses of the Pfizer-BioNTech vaccine arriving from the United Kingdom on Friday, January 29th. This second batch will allow us to vaccinate an additional 9,750 persons. I should say at least another 9,750 persons. As a country, our goal remains to vaccinate 19,000 residents, or 36% of the eligible population, by the end of March. I am grateful to the individuals, as the Minister of Health mentioned, over 13,000 of them that have registered their interest so far. And I am pleased to see the number of Black residents that have registered steadily increasing. If you're watching on CITV, there should be a graph on the screen. The graph shows the percentage of Black residents registering out of the total in the day who choose to identify their race. The percentage of residents identifying as Black is increasing, with spikes specifically recorded on the 21st of January and the 27th of January. As more information on the safety and effectiveness of the vaccine is provided, I strongly encourage all residents to read this information for themselves. I also encourage you to speak with those who you know have already been vaccinated to ask them about their experience. Yes, your arm does hurt, but that is normal for any shot or any vaccination of which you may take. The more we share credible and factual information, the more we can combat vaccine hesitancy and move forward to vaccine acceptance. Many have asked, how will taking the vaccine change your day-to-day life? At this moment, the one thing that we know for sure is that the vaccine is 95% effective in ensuring that you do not contract the coronavirus. However, at this time, after you have received the vaccine, you should continue protecting yourself. Wear your mask, practice physical distancing, and make sure you continue to practice appropriate hand hygiene. and download the We Health Bermuda app. This week, I will meet with the Minister of Health, the Minister of Transport, and the Bermuda Tourism Authority to working on formulating a long-term tourism and travel strategy for Bermuda. I say that as we might have to change our approach given the changing circumstance in the world. The government will also discuss implementing a quarantine for all travelers who are not vaccinated. Right now, this only applies to persons arriving from the United Kingdom, but we should adjust our strategy as conditions change in the world. Further, the government is working on rule changes for those who have received the second vaccine and at second dose of the vaccine. And at our press conference on February 16th, which is in 2 weeks' time, we will be able to release what those changes will be. This is time 2 weeks after the second doses were able to be administered here, and at that time we will have the first resident who will have the full protection against the virus that the vaccine can offer. As the minister stated, soon we will be moving to phase 2 of the vaccination program. Before that, I strongly encourage all eligible persons to register. Public service vehicle licensed drivers like taxi and bus drivers are eligible to receive the vaccine, so please make sure you register. I've heard some complaints from taxi drivers who may be picking up our tourists at the airport, etc. Please go ahead and register and get yourself vaccinated. The government will increase the number of vaccination centers. A third vaccination center would allow for more persons to receive the vaccine daily and help us to increase the numbers vaccinated. And as the Minister of Health said, our new target will be moved up to 800 per day. The details of the third vaccination center will be announced before the end of the week, but before then, I would like to thank the team at the Bermuda College for working with Bermuda government in this initiative. Moving to other matters. Yesterday, the Minister of Finance, the Honorable Curtis Dickinson, announced that the government had been reimbursed the approximately $11 million loan that was paid to the 700 employees of the Fairmont Southampton by the owners GenCom. The payment from the government to the workers in October 2020 was necessary, as there was no guarantee from the owners when they would be able to make the payment themselves. This government is committed to ensuring that workers are respected and can live their everyday lives with dignity, especially during these difficult times. The employees of Southampton Princess were not given a handout, but rightly paid what they were owed. Our intervention was an important demonstration that people will always be given priority over profits by the government of Bermuda. I must, however, say this. It is noticeable that we have had silence from the usual commentators or the opposition who criticize this arrangement that was made by the Minister of Finance. It is okay. You can tell the Minister of Finance, job well done, and that you may have been wrong. Bermuda is fortunate to have a Minister of Finance of the caliber of Curtis Dickinson, and I want to congratulate him publicly for his work in this, because I know that it has been incredibly tiring, but it has made the government proud. As I said last week, we must have confidence in ourselves to work together and to solve the problems together. And in this case, in this instance, the Minister of Finance has done that. And Minister of Finance, I know that Aunt Laverne would be very proud. I would also like to thank GenCom for keeping their word. Now it is on to the next phase of the development, and we are going to be working and engaging with GenCom on that to make sure that we can advance the redevelopment of that property so that we can have it open as soon as possible. Last week, Bermuda endured severe weather with storm-force winds that led to power loss for many. Thanks to the collective efforts of everyone involved, we weathered the storm with few disruptions to services. I thank the Minister of National Security, the Honorable Renee Ming, Dr. Mark Gashard of the Bermuda Weather Service, and all the EMO agencies for their planning and leadership that helped us prepare for the weather event. Unfortunately, we've had some more inclement weather last night into this morning, but thankfully not as severe. In closing, I am proud of how, as a people, we have worked together to get where we are. we can enjoy a sense of normality the majority of the world cannot enjoy at this time. Though we were able to announce positive changes to some measures tonight, this is not the time to throw caution to the wind. Let us continue to be consistent in the actions that has helped us make progress in these last few months, and let us work together to make further progress. We all need to do our part. Again, I beg you, there is testing capacity available. Please get tested. And if you are eligible, please register for the vaccination. Before I take questions, I will end with my usual comments, that we know that many in our community may require extra emotional support. If you need someone to talk to, please call the Emotional Wellbeing Hotline. The phone number is 543-1111. Again, 543-1111. It is available now if you wish to call, and is open every day from every Monday to Saturday, 5 p.m. to 9 p.m. If you are not feeling yourself, feeling isolated, or feeling anxious, please call, as there is help available. As a reminder, to get accurate, reliable, and timely information, please sign up for the government's WhatsApp service. They will also be able to notify you if our press conference is running late, as sometimes it does, as we had a long cabinet meeting today. Add the phone number 504-6045 to your contacts and send us a simple message saying hi. That number again is 504-6045, and you will receive updates from the government of Bermuda. Additionally, you can get government updates by downloading the TreeFrog app. It is available at the Apple Store or in Google Play. In the search bar, just type TreeFrog Bermuda and download that free app today. And finally, if you have not done so, and you are planning on going out to be at a restaurant or somewhere else, please ensure that you download the We Health Bermuda app and follow the precautions that are in place. Before I take questions from the media, there were two other adjustments which were not inside of my speech in regards to protocols. The time curfew for the water has been pushed back 2 hours from 6 p.m. until 8 p.m. And also there is now limited visiting that is going to be allowed at long-term care facilities. That is only going to be for outdoor visits only. And those are two additional changes which were approved by the Cabinet today. With that, I'm happy to take any questions that members of the media may have on behalf of the people of Bermuda.
Good evening, all. Thanks for having us. It's Jonathan Bell from the Gazette. Minister Bell, we had a query for you regarding the government had bought a PCR machine that we understand was intended for molecular diagnostic lab to use in their testing, but it remains with Helix Laboratories. We wanted to know why it had gone to a private lab and if it was headed over to MDL labs.
Thank you, Jonathan. That particular PCR machine was sent to Helix for her to do some troubleshooting. There was some upgrades and some diagnostic technical things that needed to be done to the actual machine. She has completed that, and we thank Dr. Spriggs for completing that exercise, and the machine will be returned to MDL probably one day this week.
Thank you for that, Minister.
Mm-hmm.
To clarify and to make sure we're clear, the machine was not given to a private lab. The machine was originally ordered by Dr. Desiree Spriggs,
yes,
as that was the setup at the very beginning, which was taking place, and that machine was over the MDL. As the Minister of Health had said, as Dr. Spriggs ordered the machine, it was sent there to make sure to get upgrades and set up so it could be returned to the molecular diagnostic laboratory. But the fact is that Bermuda is fortunate to have a number of labs that can do these services, and the government of Bermuda will continue to work with all labs to make sure that in case of any outbreaks or spikes, we can provide the redundancy and the test capacity which is required for the country.
Thanks, sir. Yeah, it does look like it was specific to that lab. I believe it was Applied Biosciences machine.
Yes, it was, but Jonathan, I think it's important that you remember the history around this. Please remember, before Dr. Weldon was a household name in Bermuda, before there was an MDL, we were at a point in time, at late February, early March, where we were scrambling to get testing capacity. And the team at Helix Labs stepped in with Dr. Desiree Spriggs and had equipment that was on island that was able to handle the testing. We had ordered a machine. That machine was delivered. It was never needed to be used as we had other things that were donated. By the time we got to this outbreak, there was a question of making sure that we had additional redundancy, and we wanted to make sure that machine got programmed. It was sent to Helix for it to be programmed, and as the Minister of Health indicated, it will be returned to NBL.
Thanks, sir. We have been receiving anecdotal reports of older folks. They say they're up there in years, they have underlying health issues, but they're not getting appointments, while they believe at least the younger, healthier people are getting appointments to get the vaccine. Have you been hearing of this? Have we identified any of gaps that might be happening in the registration system?
Jonathan, we are, as you would see in phase 1, it does include persons that are over, phase 1A, excuse me, persons that are over 80, as well as essential workers. So some essential workers may very well be of a younger age who would have been vaccinated. However, we have seen probably about 60 or 70 persons that have registered and unfortunately inadvertently put in an incorrect phone number. We're contacting persons so that we can book their appointments. However, if they haven't heard from us, that's why we're asking them to call the call center or send an email, because there have been a number of cases where people have not entered the correct phone number, so we're unable to reach them to book their appointment.
We wanted to check as well if any of these significant mutant variations of the virus have been identified in Bermuda. We've been doing some more of that gene sequencing of it. Have we found any of them?
At this point, like I mentioned last week, we have sent 10 specimens to CARFA for them to do the gene sequencing. They've indicated that there should be a turnaround time of, I think, 3 weeks, and we'll be sending 10 per month to CARFA. In addition to that, as I've also indicated, we anticipate that Dr. Weldon, through the MDL lab, will be able to commence gene sequencing in short order here in Bermuda on Island.
Righto. Yes. We're seeing cases going down nicely, and obviously we've heard more about continued restrictions. Going down the road with cases declining, can you walk us through a bit, I guess, of how government will be able to relax restrictions without getting back to a situation like we had in November, where when we tried to relax, we had a surge in cases?
I'll take that. You want me to take it?
You can take.
Thank you, Jonathan. I think that it's important that we take a step back and that we look and analyze the situation. Different countries have adopted different policies. Some have gone for complete elimination of the virus. Others have gone for mitigation strategies. Others have said, to hell with it. Let's just let everyone get it. And, we'll have herd immunity soon enough and we'll be fine. And we've seen that that hasn't worked. And it's very unfortunate to see some of the stories around the world where you see healthcare systems collapsing, people dying because they cannot get oxygen, where doctors are choosing who lives and who dies. And this is what we are seeing in a number of places. Certainly, we are seeing that there seems to be a reduction, certainly in the United States. I think that possibly the change of administration has helped, and also a vaccination has helped as well, as there's been a different posture with the new administration taken towards the coronavirus. Certainly, we've seen reductions inside of the United Kingdom, but that is due to a significant period of lockdowns with the new variant. As we meet going forward and discussing how we're going to approach this, there may be space to adjust our strategy. Whether or not, given the fact that we now know more about the virus, and given the fact that we will see these mutations which are happening, and because that some countries are just letting the virus spread throughout their populations, making the mutations more likely, we may have to adjust our strategy. As I mentioned inside of my remarks, that we will be meeting to look at the long-term planning. And what does this look like? Do we adjust our strategy from saying that, from this date forward, only vaccinated persons will be able to enter the country, and we'll be able to avoid the full quarantine regime? And anyone who is coming to the country who has not been vaccinated will have to adhere to a quarantine regime, like is the case what we have from the United Kingdom. So pre-tests, tests on arrival, and then tests on day 4. So we have slowly adjusted our strategies. We'll look to adjusting it more, But what I want to get to is a place in this time in the summer where we might be able to have periods of relative normalcy. And that may mean for us in a domestic economy, for that to happen, we may need to change what we do at the borders. And so we need to balance that regarding tourism, regarding how that affects international business, and take a look at what that is. But the fact is that we are starting from a good position. And the best thing to do to ensure that is for people to continue to get tested if they have not been vaccinated, and for those persons who are eligible to be vaccinated to register for the vaccine and take it when you are called and given the appointment.
Thanks, sir. Just for the avoidance of doubt, when we move eventually into phases 2 and 3, folks want to know if there are people from the earlier slots, people who are particularly vulnerable, who didn't get vaccinated at the time. Do they go to the front of the queue, so to speak, when we move into those later phases?
We are prioritizing, so even though we'll move into phase 2 and 3,
Yeah.
we are prioritizing those persons that are particularly vulnerable by virtue of their advanced age and or any other type of medical conditions. I think it's critically important to remind members of the public, as the Premier has said previously, we will have sufficient vaccination on island for everyone that wants to be vaccinated.
Thanks. And lastly, and the couple who got in touch, you may not be able to answer this, but they did want us to at least highlight it by asking. There's a senior couple reported yesterday. One of them was able to get the vaccine. The others has tried to get it, but they've not received an appointment yet. They were trying to leave a message there. They said the mailbox was full, and they were surprised by that. They wanted to know if that was something that was being fixed, or at least if I could bring it up. I don't know if you would have the answer to that, but.
We have increased the resources to the vaccination center, to the hotline, so that there are more persons that are answering the phone.
Right.
I'm not familiar with that being an issue concerning the mailbox being full. They have there is a email address that they can use, or alternatively, do you know the people? If we can chat afterwards and I can give you my contact details and they can contact me.
Yeah, that sounds
Okay.
good. Thanks very much.
Thanks, Jonathan.
Don Burgess?
Good evening, Premier and Health Minister. I hope you're both doing well after your second shot. I'm feeling really great. You mentioned about the third vaccination center, and earlier we've talked about having doctors and physicians and clinics being able to give the vaccination as well. What's the progress on that?
Let me clarify something, because I think that came up last week and I may have left a little bit of ambiguity. The Pfizer, because of the cold chain requirements and the fact that it has very, very stringent requirements as it relates to it has to be stored at sub-zero temperatures, and then once it's brought down to room temperature, it has to be used within a finite period of time. Once you open a vial, you have to use that vial within, there's 5 doses normally to a vial, and you have to use that also within a finite period of time. So at this point, with the vaccination that we have in Bermuda, many of the doctors' offices, in fact, I was on a call the other day, and many of the doctors, as much as they would like to assist, and I'll explain how they're going to assist in a moment, but they don't necessarily have that type of facility in their practices. However, what we have seen is that there's a number of doctors that have volunteered to work at the centers and using their time to be the supervisors or the medical leads at the vaccination centers, and they're assisting in that regard. In the future, when we have other vaccination types that don't have that severe cold chain requirement, then we will be able to utilize doctors to be able to, in their own surgeries, vaccinate people. But at this point, there are very, very stringent conditions insofar as how the vaccination, the Pfizer, has to be stored.
Okay, which leads me into the next question. With our current supply of vaccines have all come from the UK and the Pfizer, can you update us on the other supply sources such as COVAX or the Serum Institute of India or anywhere else we may be getting it?
Okay, we are, as I've indicated, we've secured, before we were even made aware that we would be able to receive the Pfizer vaccine from the United Kingdom, we took steps immediately as a cabinet to secure vaccines to the COVAX facility. They have previously indicated that they will be supplying those to countries at the end of March. It is likely that it would be perhaps the Moderna and or the Pfizer. However, we haven't gotten any further details about that. One of the considerations that the COVAX facility is also considering is countries that haven't received a vaccination. Bermuda's been very blessed to be able to receive the doses that we have thus far. So that COVAX facility, though it is certainly an avenue that we've already explored and paid for, the date as well as what exactly the type of vaccination that we will receive in Bermuda, I don't know that information yet. We're waiting to hear from COVAX.
Okay, thank you. Is Bermuda likely to be affected by the ongoing tussle between the EU, UK, and the slowdown in delivery of the vaccine from the vaccine manufacturers?
I don't think so. I mean, we're obviously all keeping an eye on that. That's something that's heavily occupied the newspaper in recent weeks. So we're keeping an eye on that. But because of our arrangement with the COVAX facility, I don't believe that Bermuda will find itself prejudiced because of what's happening in the EU and the UK with respect to the distribution of vaccines over there.
All right, thank you. On the subject of vaccine hesitancy, thank you. How would you describe the progress that you're making in terms of allaying the concerns of some Bermudians about taking the vaccine?
I think through education, you would note that we've been doing a lot of Facebook Lives where we have doctors and scientists and so forth speaking about the benefits of the vaccine. Again, we're encouraging members of the public to look for the proper sources, trust the science, look at on the government website for the information that they wish to have concerning the vaccine, as opposed to other sites and sources that are not necessarily credible. We have seen an increase with respect to certain populations that have not necessarily been interested in vaccinations. I think what we're trying to change the wording now, instead of saying vaccine hesitancy, vaccine appropriateness, because it's appropriate to get a vaccine because you're not only protecting yourself against COVID, but you're also protecting your loved ones and members of the community. So it's appropriate to get a vaccine, and that's why we're trying to encourage members of the public to start with educating themselves and asking the right questions. And there's plenty of information that's reliable and credible based on science and evidence that's on the government website.
Okay. And my last question for tonight, the 19,500 doses that were received on the BA flight, is that based on 5 doses per vial or 6?
The FDA, as you know, on the 6th of January indicated that the Pfizer could be used in 6 doses, but the instructions for the ones that we received speak about 5 doses. In some cases, we are getting 6, but the directions on the Pfizer vial say up to 5.
So it's possible that we're going to get more than 20,000.
Correct, because
Okay.
there have been cases where we are getting 6, yes.
That's why I was very careful by saying at least these amount of persons.
All right. Thank you very much.
Thank you.
Good evening, Premier, Minister.
Good evening.
Maya Palacio here for Media Maya. My first question, Minister Wilson, I know you already mentioned it tonight, and I want to ask if you can mention it again, because there are persons who feel like they're still confused about where they need to go when they have an appointment for the vaccinations. So if you could just restate the information you said tonight as to, like, once they've received it, they're not sure if this is to go to one place or the other. How can they
Okay.
confirm that?
When they receive the phone call, they'll either receive a phone call or an email, and it will identify which vaccination center. So it would either be at Police Recreational Club in Prospect, and we're asking people to park at the Clyde Best Field, or stop at the Clyde Best Field first, because we have had challenges with respect to bottlenecks of parking. So stop there first, and then the regiment will direct them accordingly. So you'll either have an email or a phone call that will direct you to either the police club or alternatively BHB, the old emergency department. So at this point, those are the 2 vaccination centers, and persons will be provided with instructions as to where to go accordingly.
Okay. Thank you very much.
Also, just one other thing, Maya, if you provide a mobile phone number, when you register for the vaccine, you'll also get an SMS reminder, which will come to your phone the day before, which will tell you precisely where you need to go.
All right, thank you very much. That question came primarily from people who got emails, majority those in the older, over 50s, 60s department. That's where the question came from. So it's most likely someone got an email and was questioning. My second question, Minister Wilson, is if someone had contracted the virus and their blood was confirmed to have antibodies, do they need to get the vaccine?
If you've contracted the virus and you have the antibodies, I believe the evidence is still suggesting that after you have 14 days after your negative test following being positive, that would be the soonest that you can get the vaccination, but there still is evidence strongly suggesting that all persons should be vaccinated, whether or not you've received the whether or not you've contracted the virus. I do know that there's a time period once you've contracted the virus before you can get the vaccination. I think it's 14 days from the negative test after you've been exposed to the virus. Wait 14 days. When you get a negative, then you can get get the vaccination.
Okay, so even if you have been confirmed to have antibodies in your blood system, you still need to
Correct.
get
The evidence is still suggesting that you should still get the vaccination.
Okay.
Yes.
And if I may build on that, Ms. Palacio, what is important to note, that when we unveil the guidance for persons who have been vaccinated, it will not take into account persons who may have antibodies or not, because that is not something that is officially recorded in an electronic immunization record or a vaccine passport or anything of those natures. So although those persons may have a level of protection that others may not have, we have seen certain places where persons, and this was the case in Brazil, where they thought that they could go with a herd immunity strategy, and the president says, if everyone gets it, then we'll be fine. And now we're seeing persons who are now being reinfected with a different strain. And so the best way to protect yourselves and your families are to go through and get vaccinated.
Thank you very much. Minister Wilson, my third question is for you. Once someone has received both doses of the Pfizer vaccination, how long will it be 95% effective of the COVID virus?
That is, the evidence is still out on that. When these particular companies applied for the emergency use authorization, they were applying for us to be able to get the vaccination, and that the studies that they conducted were to show that a person that got the vaccination would be less likely to catch COVID and or catch any symptoms to it. Insofar as the studies that are ongoing still is whether or not a person that has vaccinated can transmit COVID, how long will the vaccination last for insofar as keeping you guarded against COVID. Those are things that the evidence is still out, and they're researching it as we speak. You can appreciate the vaccines have only been out for a few months now, so as more people become vaccinated, more people will be able to be part of those studies, and that's what's that's what's taking place now.
Okay, thank you very much. So just to confirm with that, it could be a possibility that you have to continuously take it then, like get vaccine one time, maybe like once a month, once every 3 months? Sorry, once a year type situations.
That's what they're looking into now. That's exactly what the companies are looking at.
So it can be a possibility, but as Minister Wilson said, we don't know yet. And when phase 3 trial started in June, of course, it's now just February, so it'll be difficult to measure. You can't predict the future. What they're doing this is based on science and evidence and based on the persons who have gotten the vaccine, and so they can measure those things and continue that. And when that analysis is released, I'm sure that it will be shared. But I know that there's persons who want to imply certain things, and the truth is we don't know. What we do know is this. If you do get vaccinated, you will be protected against the coronavirus. That is the one thing that we know for certain, verified through double-blind, randomized tests, 95% effective after 2 doses. That's the one fact that is indisputable.
I'm curious, can we by any chance be able to like test that here on our own island, like whether how long it's effective? Like, can our doctors do some work where we can find out ourselves if how long it's effective here on the island, or is that more just like in a way situation? We don't have that type of capabilities in Bermuda.
I would think that the companies that are actually conducting the trials probably have far more resources with respect to expertise, equipment, and so forth than what we have on island.
All right, thank you. My next question is for you, Mr. Premier, although it might be directed to Minister Ming, but she obviously is not here tonight. At least 3 men at Westgate have been granted parole but can't be released due to a shortage of electronic monitoring devices. One person has been waiting for over a month. So will the government be providing more monitoring devices, and if so, when?
I am not familiar with that situation, but I'd actually put that question in writing towards the government, mediacareers@gov.bm, and we'll endeavor to get you a response.
Okay, thank you very much. And my final question is about the curfew being continued, because I know I'm going to get a lot of questions about it, is what was the health advice that led to it continuing, and when will it be a possibility that curfew will be relaxed?
What we are finding is that right now we're trying to vaccinate the population, right? The more people that we can get vaccinated, the more likelihood is that we'll have herd immunity and that we can have a more regularized space of normality. However, we are trying to avoid the mixing of social gatherings that oftentimes take place in the wee hours of the night under the influence of alcohol, where people's inhibitions are reduced because of the alcohol. And so less mask wearing, less physical distancing and the like. So it is unfortunate, and I appreciate that that there are people that want to remove the curfew, but from a public health point of view, we are concerned about the social mixing that takes place with respect to large consumptions of alcohol, particularly in private homes in that hour. So it's just a matter of trying to curtail that particular environment, which could help to see a outbreak in Bermuda, particularly at a time when we need to spend all of our resources on vaccinating people.
Thank you very much.
Protection of the health system, as the Minister of Health has said before, is not just the hospital. It's also the persons who run the health system, the nurses and everyone else, and recognizing that Bermuda is not a massive country. So the teams that are at the Ministry of Health doing the contact tracing and outbreak management are also the teams that are assisting in the vaccination effort. And so the recommendations and advice were given, and they have been accepted. I do know that they will be reviewed. The expected time for the review will be in 2 weeks. I know that people do not wish to be on curfew. Trust me, I don't like it either. But what is critical and important is that we learn our lessons from the past. We had low active cases the last time an outbreak started, and low active cases is not a fully decided indicator as to whether or not you have low prevalence inside of your community. We have to keep on testing. That's why I encourage persons to make sure they get tested. The minister has noted about how we're rolling out community testing with saliva tests and other things, and that's what's critically important. So we will certainly review it. I recognize the challenges that are there, but we have learned from past history, and right now where you see there are so many challenges which are taking place throughout the world, what we want to do is to be absolutely and perfectly sure before we start removing that particular restriction or starting to add group sizes or other type things. I want to make sure that we get through this period. That was the advice from health, and I recognize the concerns, but we are trying to balance those concerns with what is most important so we can return to a sense of normality quicker. Let go of curfew, let go of restrictions, have another outbreak, and then we're back to square one. And I think that we would be much rather not have to go back that way.
Thank you very much, Premier and Minister Wilson. And to the community about Cheval Dillon Burgess, if you know something, say something.
Thank you for that, Ms. Palacio.
Thank you. I have TNN.
Oh,
You have
okay.
called in with a few questions. Cover, please speak clearly and as loud as you can. Thanks. Oh, wait on. Sorry. Hold on a second, Carol. I got to put you on speaker. Okay, go ahead.
Good evening, Trevor Lindsay calling via Southland. Thank you for receiving me. My first question, Premier, you would be aware that the Bermuda Industrial Union on the program last evening, Union Corner, accused the government of rolling out the same immigration reform that the OBA government rolled out for something very similar. How do you answer the queries of the labor union?
What I would say is, number one, that information is not correct, and anyone can look and compare the reform measures that have taken place under this government versus the reform measures which were proposed by the previous government. We have moved with a spirit of consultation, but what we will not do is that we will not impede the progress of the country when there are persons who may have a different view. We have taken a constructive view towards this. We have made sure that we are continuing to consult, and we are going to move forward. And if some persons do not agree with the policy, that's fine. That is what we deal with in a democracy. But the government's responsibility is to advance change. What I will say is, on that exact same program, the Minister of Labor called in and corrected many of the falsehoods, and the persons there then may have changed their tune following the Minister of Labor's call in. We recognize that immigration is a difficult issue, but the Minister of Labor has done a number of things to ensure that Bermudians are at the heart of our economic recovery. He will be giving further press statements on that, and I encourage persons to tune in. For those persons who may want to interact with him on social media, feel free to do so and get the facts straight from the horse's mouth. But I reject completely that it is exactly the same. That is false and cannot be justified in any way, shape, or form by the evidence in force.
Next question.
You do agree that consultation would be the best way forward for everyone involved, the unions, the people of Bermuda, and the government, correct?
Mr. Lindsay, there has been consultation that has been ongoing for a significant period and point in time. And so the only thing, what we are speaking about in this case and instance, Mr. Lindsay, is the introduction of an economic investment certificate. Right now, people can get a long-term residency certificate and they have to be wealthy in order to qualify for it, but they do not have to invest their money in Bermuda. The minister is taking an existing policy and changing that policy so that it benefits the country and investments inside the country. It is the right thing to do. And what I would say is that there is the existing policy now, which is going to be changed to a new policy, which will benefit Bermudians. And I think that that is what we were elected to do.
Moving on to the COVID issue, the vaccination issue, government has moved on to register in phase 2, I'm sure. I think when they have not even finished phase 1, A and B, why have all the phases, or the persons that are supposed to be receiving phase 1 have not received their vaccine yet, and you are moving on to getting persons for phase 2. And to note, I met many people calling and saying that the number that you have given out is not working, the mailbox is full, and they're not getting responses from emails to that hotline number.
Okay, Trevor, I'm going to look into that because somebody else actually earlier tonight said that there was an issue concerning the email voicemail being full. I thought that matter had been resolved, but I will be looking into that this evening. Also, with respect to, I don't know if you heard me speaking to Jonathan earlier, unfortunately, there have been a number of people that, I think almost 60 at least, that had registered that would have been in phase 1A that provided us with inaccurate phone numbers. So we can't contact them to schedule their appointment without a proper phone number. So we're asking persons, if they would have been in phase 1A and haven't heard yet, to contact the vaccine center at the number that I've previously mentioned, or alternatively to send an email so that they can receive their appointment.
This is a question coming from bar owners, minister or premier. Why is it that you can sit at a sushi bar and get food that's prepared directly in front of you, but you cannot actually sit at a bar to receive a cocktail? These two scenarios seem extremely hypocritical.
As I understand it from the guidance, you're not supposed to have any bar service at all. So you're saying people are sitting at a bar eating. That's kind of tearing it a little bit. The principle behind that is that when persons are consuming alcohol and standing up at a bar, then there's more of a chance of people congregating in close proximity as opposed to sitting at a table. Food service is meant to be at a table.
Okay, my last question. Is there any likelihood of Johnson & Johnson vaccine will be available in Bermuda? From what I understand, the only one to be tested against the new strain, but I do stand to be corrected on that. Are we going to be receiving the Johnson & Johnson vaccine in Bermuda?
We are looking at all the available vaccines. Like I said, COVAX is looking at probably providing vaccines to Bermuda, but we are looking at all of those. Johnson & Johnson certainly is one that we're considering. It doesn't have a high efficiency rate as the other ones, notwithstanding that it's only one dose. So there's a number of considerations that we're having with respect to acquiring the vaccine.
Okay.
Thank you very much.
All right, thank you. Trevor, I really thought that you were going to ask about the $11 million return to Fairmont Southampton Princess employees, as you ask every week but I'm grateful that that has been done, and I want to thank everyone for certainly for their questions this evening. I know that a number of persons wrote in on social media. I do believe that most of those questions were answered either in my statement or otherwise, but if I have not and you wish to pose a question, feel free to do so on Twitter at Bermuda Premier, and I will happily take some time this evening to respond to your questions and queries. With that, everyone, I wish you a good night, Bermuda.